Good morning, Dr. Baumholtz, and I just want to take a minute and talk to you about breast implant sizing. Let's spend a minute or two and demystify how I approach breast implant sizing. In many ways, it has to be more simple than what's being presented to most patients. Briefly, we take a measurement from the outside of your breastbone or sternum, and we go to where the ribs start to turn into your armpit. That's your base diameter or breast width. I often refer to that as the foundation for a house. We'll then determine, based on your anatomy, how far and what you want, how far out we want this breast implant combination to stick out from your body, the projection or profile. I like to talk in terms of stories of the house. So you got a 1-story, a 2-story, a 3-story, and sometimes even a 4-story, depending if we're talking saline or silicone. Any wider than the curve of the rib, and that implant, or at least part of that implant, is sitting in your armpit. Now, that's not a look most people want, but you have to understand when you start to violate these anatomic norms, this is what you're going to get. We also marry that in our practice with asking patients to go onto the internet and find pictures, naked breast pictures in body types similar to theirs of looks that they like, so we can get a sense of how reasonable their expectations are and how much we can match that with what we can do. Finally, in our practice, we have the luxury of a 3-dimensional modeling program where we can actually take the patient and put the different implant simulations in them and get a sense of what things will look like. That also helps the patient see whether there's a need for a lift or not beyond what we've already discussed up to that point. Well, I hope that helps you in your journey for breast implants and understanding how sizes happen. By the way, I didn't mention cc's. A lot of patients will come to us and they'll say, I want a 400cc or 200cc or whatever cc it might be. cc's, in my opinion, is the byproduct of the analysis we just discussed. It is not the driving force, right? Because let's take 400cc's, for example. 400cc's could be wide and flat, or tall and skinny, so that number by itself is not enough. You really do need the base diameter and the desired projection to get a sense of what cc's we're going to use. Well, I hope that's helpful. Have a great day. If there's any questions we can answer, please call us at Baumholtz Plastic Surgery. Thanks.